Tonight, the number of COVID hospitalizations in our valley is up significantly compared to just a few weeks ago, and our hospitals continue to deal with some major challenges. I spoke today with the Chief Operating Officer for Desert Regional, Mike DeToro. Mike, first off, what's the latest at the hospital?
Hi, Peter. Today at Desert, we have 98 COVID patients and we have 17 COVID patients at JFK. So totaling 115 for the Desert Care Network in the Coachella Valley.
How does that compare to earlier with the Omicron variant?
Yeah, we're up significantly from the last time we spoke a few weeks ago. We're seeing our positivity rate right now is about 29% for the month of January, which for context is up from 12% in December. So that positivity rate suggests that we're going to continue to see our numbers climb here over the next couple of weeks. And that's consistent with the modeling that the county and their statisticians are giving us.
And are the majority of these patients unvaccinated?
Yeah, sadly, of the 115 that are in our two hospitals here, only 9 are boosted. And boosted is really what we're treating as the new completely vaccinated.
What other difficulties is the hospital dealing with right now?
You know, there's a few things. I would say staffing has just been a challenge for some time, and we continue to offer incentive bonuses, and we're consistently bringing in additional travelers to assist with the load. But we're just eternally grateful for our team. We even gave all of our full-time workers from last year recognition bonuses just as a way of saying thank you. That's been one struggle. Another thing that we've been challenged with is the inability to move certain patients that are ready for discharge out of the hospital. And a lot of these patients are being discharged to certain settings like skilled nursing facilities or to go home with home health. And some of those agencies are having a hard time either because they're on admission holds or for resources themselves that they're unable to take patients. And it's just creating much longer lengths of stay for patients in our facility who truly are ready to leave.
Is hospital staff being asked to work if they test positive for COVID?
Let me start by saying that nobody will come to no staff is working at the hospital that is sick or symptomatic. So whether you test positive for COVID or not, if you have a fever and have real symptoms, folks are asked to stay home. The Department of Public Health does have new return to work guidelines that suggest if somebody is positive with COVID, but has rapidly improving symptoms and no longer have a fever, there are certain circumstances where they can return to work. And that would be by wearing N95s and being safe, as well as cohorting them to care for COVID positive patients only. So there are provisions to bring folks back. And we do here at Desert Care Network follow the orders that come from the Department of Public Health. But rest assured, if somebody is truly sick and has a fever, they don't come to work.
How is the morale at the hospital overall right now?
You know, I think we have a lot of fighters here. There's fatigue amongst the staff. I think there's a lot of pride within this environment of the great care that we continue to provide, despite challenging circumstances that, you know, we've unfortunately been going through for a couple years now. But we can't thank our team enough. And I would just encourage the public that for those healthcare workers that you know, thank them when you see them, and you know, just understand it's been a long haul. It's been a long haul for everybody, and you know, we're eager to get past this at some point.
As always, Mike, we appreciate your time. Thanks so much for joining us.
Thanks, Peter.